surgery, some people might have some chest pain. We talked a little bit about that fullness that you feel in your shoulders, but one of the major complications of any surgery is having a blood clot. It's not a huge risk that happens to a lot of people, especially with this type of surgery and especially with things done laparoscopically. But if it happens to you, it's a big problem. So let's just say you're 3 weeks out of surgery, you have some chest pain, you wake up in the middle of the night, the elephant's sitting on your chest, you're going to call 911 and then have yourself checked out. But during office hours, anything like that, you're going to give us a call and let us know. Of course, with the surgery, you're going to have several little incisions. Dr. Cohn closes that, puts little steri strips over that, and usually a gauze pad that can come off the next day. Those steri strips stay on 7 to 10 days. He likes to see you after surgery, and you can call the office and we can kind of let you know when those can kind of come off. With pain medication, we can order pain medication for you before the surgery and have that ready for you to be picked up, especially if you're doing this on an outpatient basis. And pain control is one of those things that it's hard to know. As we said, everything should get better and better, and just remember the first day or two, yes, you might have to take medication about every 4 to 6 hours, but usually you're able to come off of that fairly quickly and go to Motrin, Tylenol, or some other things that we could talk about. Sore throat is often a problem after surgery due to the tube that's put down your throat for anesthesia. Usually doesn't last too long, but we'll want you to just drink some ice water, something warm, and typically that'll get better. Sometimes after surgery you'll notice that you have a cough, or you're bringing up a lot of phlegm, things that are in the lungs. Please cough, please bring that up. We want that stuff to come up. You can use a pillow that you have at home, something like that, place that over your tummy and use that to kind of splint the abdomen as you breathe. Activity after having surgery, everybody's different. We can't really predict how quickly you're going to be up. We have some women that are up and at 'em and say they feel great, and others that it takes them a little bit longer to get things going. So each person's surgery is a little bit different. So we're not going to say you should be doing this or you should be doing that, but we definitely want to encourage you to get up and move and get yourself going as quickly as possible. We don't want you lifting anything greater than 15 pounds for 6 weeks after the surgery. Means you can go to the store and you can go shopping and put stuff in your grocery cart. Just people need to load up your car and bring it in at home. Heavy duty housework. I know you're going to be at home and seeing things to be done, but no vacuuming, nothing that requires a lot of use of those abdominal muscles. You're of course going to have to write a card and want to encourage you to bring some pillows, things that are going to help you be comfortable to do that. Houston streets aren't the best, and you can drive a car when you're not taking a narcotic pain medication. Some people, you need to make sure that you can manage your vehicle. So that means you have to be able to stop and move around and be able to see behind you. So just keep that in mind. Up and down stairs as you're able to. Just don't want you carrying all the laundry upstairs with you or carrying a child up with you at the same time. You can take a bath or shower as you feel able to. A lot of times that feels great after that first day of surgery. You're just going to, when you get out, pat it dry, pat all the incisions dry, use a hair dryer to help dry that. You can start walking as soon as you, of course, feel able to. I encourage patients to get outside. Maybe start by walking to the end of the block and coming back and increasing your activity gradually. Also, kind of getting around the house will be helpful. With your incision and taking care of that, we would like for you to use a heating pad to your tummy as soon as you get home. That increases circulation to the area, it helps it heal faster, and it also feels real good. There's some things listed here. If you have any increased redness, pain that's different, it's not uncommon to have a little bit of clear discharge from the incisions. That's very normal. But if something looks like it's foul, it has an odor to it, it's very, very painful, you notice things have really changed, you need to let us know. As far as going home and what you should be eating, we do encourage you when you first get home to take things a little bit easy. You don't want to stop by for a hamburger. You want to start first with clear liquids, go to things that are kind of bland until you know that things are going to be fine. Returning to work, that's hard to know. Some people have a very sedentary job. They sit at a desk, they don't have to do much, and they go back in a week's time. And others we know are on their feet a whole lot, have to do a lot of lifting, pushing or pulling. Those things you may require more time off. As far as if you have a discharge, we don't want you to use tampons, and would not want you to have intercourse for 6 weeks or until you come back for your last post-op exam. Constipation is many times a problem after surgery. The pain medication, anesthesia is can cause that. So we encourage you to use a stool softener after surgery, especially as long as you're taking pain medication. We use Colace or Ducasate, which is over the counter, 100 milligrams in the morning and in the evening. Also, if you have a temperature after surgery, we consider that 100.4, and that's on 2 separate occasions, and that's 4 hours apart. So let's say you take your temp at noon and it's 100.4, you take some Tylenol, and 3 hours later it's still that. We would want you to give us a call. Most of the time as an adult, if you're having a temp like that, you don't feel well, so you're going to be giving us a call and saying, what's going on, what do I need to do? Here, and lastly, just remember, pain should always get better, not worse. So let that kind of be a guide for you. Each day should get better and better. And just to let you know, we here at Dr. Combs' office are here to help you. We want to have your recovery be as uneventful as possible, and to help you get back to where you're able to function and enjoy life again with your family. So, thank you.